maybe we can present some instructions before we move forward. Well, for those who speak Portuguese, we have a globe whereby we can choose the language that we wish to follow the meeting, because we have interpretation services. We also request the participants who are here, please introduce yourselves through the chat. Please write your name, country, and institution. Who wishes to talk, we also request you to raise your hand so that we can give you the floor. I see that we have more or less 24 participants. And I believe we are going to get more people joining us during the meeting. So I request next slide. Well, here we have our program for today. I've already indicated how people should introduce themselves in the chat, and also request we keep our microphones muted. And we are also going to do a presentation by Dr. Ivandra Libombo regarding condom management in the public sector in Mozambique. And Dr. Ivandra, she works for CMAM on the Drug and Medical Supply Center. So she will talk about how the distribution process has been done. And we'll also have the second presentation, which will be made by Dr. Marius Sitoy, who will present on community condom distribution chain. So Dr. Ivandra will show us how the condoms come in the country up to the medical centers. And Dr. Mario will present to us how the condoms are distributed in the communities. So after these two presentations, we are also going to have a session for questions and answers, or maybe even comments. And the two presenters will be able to answer to any questions in case there are. And fifth, we are going to invite the participants from Nigeria, Tanzania, Uganda, so that they're able to tell us what do they think about our presentations, and they will be able to give us their recommendations. And lastly, we are going to have the closing remarks. And at that moment, we'll be able to share a survey so that we are able to share our ideas and what we thought of the meeting. And I believe in like 1 hour, 1 hour and a half, we'll be able to finish with our work. Next slide, please. Well, I've already made my few remarks to open this session. So I'm going to invite Dr. Ivandra to be able to make her presentation. Dr. Ivandra, you can speak in Portuguese because we have interpretation. Dr. Ivandra, please take the floor. Thank you very much. Good morning to everyone. My name is Ivandra Libombo. I'm responsible for the Department of Planification and Quantification of Medication and Medical Products. I was invited to make this presentation regarding the condom management in the public sector in Mozambique. Next slide, please. Well, in Mozambique, the condoms reach the indicators through three main sectors. Well, we have the private sector, we have the social marketing, and we have the public sector. So regarding the private sector, it goes through the private companies which operate in the market with market-based prices. And it also depends on the brand of the condom. So for the social marketing, it's through non-profit organizations. For example, we have DKT and PSI, which they provide the condoms in places of high access and at reduced or subsidized prices. And lastly, the public sector, the condoms go through the mechanisms of the Ministry of Health and also through the National AIDS Council, who provide condoms to civil society free of charge. Well, the presentation focuses on the public sector, whereby the management is centrally, it's centered under the responsibility of the Central Medicines and Medical Supply Services, which they receive the condoms from the government and the main funding mechanisms. So here I'm talking about specifically, I'm referring to USAID, UNFPA, and the Global Fund. The public sector is able to reach even the most remote communities through essential medicine kits that also include condoms. Next slide, please. Well, first to do the needs planning, we do this through a coordination mechanism through the Ministry of Health, through the Central Medicines and Medical Supplies, and through a National HIV and AIDS Program and the National AIDS Council. We also have some kind of participation through our main donors, which is the UNFPA, UNICEF, USAID, GHSC, PSM, Pathfinder, PSI. So the assumptions of projects based on the population and on coverage targets stipulated by the country with advocacy from UNAIDS and CNCS. We also use the CAT tool to draw up the condom supply chain and monitor orders, shipments and entries into the central warehouses, as well as the stock situation. Well, the funding for supplies guaranteed mostly by donors and EOS, which is the Ministry of Health, USAID, and Global Fund. Next slide, please. Well, here we have the needs supply. This is where we do our quantification, where we do the exact period and the products that we've received and the amount of products we need to supply. So we work here to be able to identify the quantity of condoms which need to be supplied Well, the one in blue. Sorry, I can't hear her. She keeps on cutting. So in blue, we see the different quantities which are supplied by the partners. Next slide, please. Sorry, I couldn't hear her that she was cutting. Well, here we have the male condoms, and yesterday we looked at what was quantified. For example, in orange, this is what we received. In yellow is what was donated to us by UNFPA. The blue one, it was donated by USAID. In green, we have by GFATM, and we also have what was given by Global Fund. But we can also see on the table on the side, we see the progress of the years and the quantities that we've managed to receive and shared. So there we have the total amount of the quantities of condoms which we managed to receive and distribute. Below, we have the situation of the female condoms, and we can also see on the table next to it, since the year 2018, from the quantity of condoms that we managed to receive from 2018 up to 2023. So we started from 2 million in 2018, and up to 2023, it will be the total amount of condoms received. Next slide, please. Well, this slide shows us our logistic chain and its distribution on how it's organized. So we have condoms which enter the country through our partners, and we show the mechanisms that we communicate with our donors, and then these condoms come into the country and they're taken to our warehouses, where we have three regional warehouses, one in the south, one in the central Mozambique, and one in North Mozambique. So depending on how we do our planification. So at that moment, we see how we are going to share the distribution of and the management of the condoms. And also we look at how the transportation of the condoms will be done. So these central and regional warehouses distribute the medicines, whereby we also include condoms and lubricants. And they do this to 17 provincial and intermediate warehouses. And these warehouses do the distribution to 1,600 health centers and to 7,900 basic health workers. Well, the provincial warehouse, the provincial warehouses and intermediate also supply the provincial and district AIDS council, which in turn provide condoms to civil society organizations. So at the district level and at health unit levels, condoms are also provided to community-based organizations. And the chain also has a limited storage and distribution capacity. But however, the plan to introduce district condom containers is being implemented. And this will help increase the distribution capacity of condoms. And this will help us to increase the warehouses. Thank you. Next slide. Well, this is the quantity of condoms which were distributed on the central level during the different years since 2018 up to 2022. So here we have the quantity of male condoms which were distributed and female condoms which were distributed. And here we can also see that in 2021, the level is very high due to the pandemic, the COVID pandemic. And we also are able to see that there was a high level of distribution of male condoms, which was about 119 million condoms. And up to September of 2022, we had already distributed on the central and provincial level about 179 million and 700,000. And the distribution flow, like I had said, it starts from the central level to the district warehouses. And from there, these condoms are distributed, and they're also sent to organizations and institutions or companies that do condom distributions. Next slide. And here we have the distribution from provinces to districts, and this is the scenario that we had, like we can see here. So for the male condoms, the distribution from the provincial warehouses to district, the quantity that was distributed is about 119 million and in 2021, and up to 2022, we had already distributed about 90 million condoms, male condoms. Next slide. Well, the distribution situation status, we managed to get some good results. CMAM had increased its distribution of condoms through a national supply chain from 2018 to 2022. Like I'd said before, in 2022, there was a reduction on the supply of the condoms in the health centers. That was due to COVID-19. We created, but in 2021, there was a big increase, which we managed to hit a very high record of 119 million male condoms and almost 3 million female condoms. And in 2022, depending on the distribution, which will take place in the fourth quarter, the idea is to be able to see how the response will be. We hope the quantities will really increase compared to 2021. Next slide, please. Well, here we have the financing for 2023. And here we can see that we have about 7.7 million dollars, where where we already have the GFTM already guaranteed with about 3.3 million. And we have another 3 million, which is still on the process of approval. And also the financing of USAID, it's about 1.3 million. And we also have, sorry, this is why we've put here in TBT, because it's still waiting for approval. Well, the funding, the funding, it's already in process. This is as by GAFTM and USAID, and we are already waiting for its approval for 2022-2023. And once this is approved, they will be able to follow up with the purchase of the condoms. So we didn't have any type of funding by UNFPA, but there is a projection for the financing of the project. Next slide, please. Well, the challenges. This is due to the large amounts, large volumes of condoms, which limits the transport mainly from the provinces to the districts and from the districts to the health centers. And also the insufficient spaces for storage in the central warehouses and at other levels of the supply chain. The condom stock management by scent, whereby many places only receive one type of scent. So we are still trying to look how we are going to manage this situation of scent. And we also have the management of reporting of information. This is mainly of female condoms. Well, on recommendations, we want to strengthen the activities to promote and create focused demand for the population and young people and adolescents. We also want to create demand for the use of female condoms, regarding also its prices, so that our people are able to buy mainly among the population, and also strengthen public-private partnerships in condom distribution to communities, improve intra and intersectorial coordination. Here we are talking about public sector, private sector, civil society, donors and partners, and also monitor male and female condom distributions, and also improve condom availability points in the health centers and as well as in the communities. Next slide. But the distribution situation and the main points of reflection. Well, the capacity of the supply chain and to meet the growing needs for condoms in Mozambique, bearing in mind that it is a product with a high level impact on the supply chain due to the quantities and to its big volumes. Here we are talking about the spaces, the storage spaces, the transport management, and also increased number of products and complexity with the district containers. The need for medium-term management by sense. Well, at this moment, the distribution is essentially by the expiry date of the project. And also there is a need to distribute a big quantity of cents in the district containers. Well, the capacity of management in the containers and also the distribution to district containers the records of transaction and preparation of requisitions, and also the data capacity and communication. This is also availability of internet. It's also a big challenge, which we are also supposed to look at it. And I think I'll stop here my presentation. Thank you very much. Thank you, Dr. Ivandra, for your presentation. I would just like to inform our colleagues, the participants here, if you have any question, please write them down on the chat while the presentations are being made, or you can save them to the session of questions and answers. Can we move to the second presentation? I'm going to invite Dr. Mario Sitoi to be able to share with us his presentation on community condom distribution chain. Dr. Mario, please take the floor.
Greetings to everyone here. My name is Mario Alexandre Sitoi. I'm an acquisition technician for the condom acquisition of the National Council for the Combat of AIDS. As I was saying, as an overview, the presentation should have the following topics. In first, the context of the community distribution. Next slide, please. The stakeholders in the distribution chain for the condoms, the distribution chain for condoms at a provincial level, a district level, and community level, but also we will talk about the district containers for condoms and the distribution of the condoms. I seem to have lost him. Through the same containers. And lastly, we'll talk about apologies, the network doesn't seem to be very clear. It is important to note that the distribution of condoms at the community level has as a goal increase the availability and accessibility of the condoms so that there's a reduction of HIV infections and STIs, and also the unwanted pregnancies in priority populations at a district level, at a province level, at ward and neighborhood levels. We want this distribution to reach the last beneficiary and the last mile. We would also like to notice that this distribution of condoms at the community level includes the male condom, female condom, and the lubricant gel, and that's one of the components used in the sexual act. Next slide, please. Now I'll speak about the stakeholders of the distribution chain for the condoms at the community level. Dr. Ivandra had already mentioned some of these stakeholders, but I would like to specify at the community level those that have influence at the community level. We have the first as the National AIDS Council. This is a central body from the state that is responsible to coordinate the actions and implementation of the national response to HIV/AIDS. At the provincial level, we have the provincial councils for the combat of AIDS, that they have representation in the provinces and they coordinate at the provincial level the implementation of the response for HIV and AIDS. And at the district level, we have the district councils for combating AIDS that are well represented, and they are responsible for the implementation of the actions and policies to respond to HIV and AIDS. Next slide. Next slide. It's important to highlight that this coordination for the response, be it at a national level, provincial level, or district level, will include integrated actions and policies for the continuous, permanent distribution for male and female condoms, and also the lubricants at the national level. Following the other levels, we also have the stakeholders as the institutions from the public and private sector. We talk about private companies and public companies that support the fight against HIV in through their actions of availing condoms in health institutions and dispensaries that exist in private locations such as washrooms and such places. We have an example of this as ministries that share these condoms in their institutions, be it at district level, such as like the district governments and the city councils, that ensure that these condoms are availed so that the clients can have access to these condoms, but also the staff of these organizations can have access to these condoms so that they can later use them. As the last direct stakeholder in this distribution chain for the condoms, we have the NGOs and the CBOs and the grassroots organizations that are civil society organizations, be it national or international, that are usually not for profit, and they are committed to the reduction of the HIV prevalence through interventions, specific interventions to reduce the HIV prevalence. And these interventions include the condom distribution and lubricant gel distribution. Next slide, please. Next slide. Okay, yes. I would like to talk about the distribution chain at the provincial level. If you recall, I mentioned about the provincial councils against AIDS in the 11 provinces of our country that coordinate actions and implement response actions to HIV/AIDS. These provincial councils, following what Dr. Ivandra had made, they request and receive the condoms through the DPMs, and they avail these condoms to the institutions of the public and the private sector, and NGOs are headquartered at the provincial level. And these availing of the, sorry, there's a noise. It seems that there's a microphone that's on. I'm not sure it's an interaction. As I was saying, the availing of the condom will follow the presentation of the use history that is presented through the parasims. These provincial councils will avail the condoms to the sub-recipients that are the district councils to fight AIDS, following the focal points on the HIV fight, and some of the actors responsible for the response at the district level. These councils also avail the condoms in their institutions where any citizen or client that want to has access to the services of the district council can find the condoms in their institutions. As I was also saying in the beginning, I said that the provincial councils avail these condoms to the private public institutions, NGOs, CBOs, and so on. And these institutions will make the distribution of the condom, will distribute the condoms at the provincial level, be it at the civil society level or at the private and public level, but at the province level. Next slide. Here we have some images that illustrate the activities for condom distribution at the province level, at the provincial council level. The first image is of a storage or warehouse that after the council receive the condoms, they'll store it, and we'll do stock management of these condoms. And then in the other two images, we can see that we have a fair where the provincial council makes the condom distribution to the public that participates on this fair. Next slide, please. Right now, we'll talk about the distribution chain for the condoms at the district level. That isn't that different from the provincial level. At the provincial level, the district councils will make a request and receive the condoms through the provincial councils, but also we know that, as it was mentioned, the deposits, the medical deposit stores have a representation at a district level, and they may also avail or distribute the condoms to the district councils, and these district councils will also avail and distribute it to the institutions of the public or private sector and civil society organizations at the district level or at a lower level. I talk about administrative posts, the villages, the wards, and so on. What doesn't differ from the provincial level is that they will also avail these condoms on their institutions so that the people may have access to the condoms. Next slide, please. We can see here an illustration that has three pictures. The first one showcases the small warehouse that the district councils have to store the condoms. In the next image, the one on top, we have a meeting in which the province council and some CSOs are talking about strategies for distributions of condoms. As we said, it's a coordinating body that implements the response to AIDS. And we have a meeting for the strategies to reach the last mile. We have also below an image that showcases the condom shipment to the CSOs that are CBOs and NGOs. Next slide, please. We also have the distribution chain for condoms at the community level. At the community level, we have two routes that had been described before, where the first route is through the institutions from the public and private sector that work at the district level or at the administrative posts, wards and neighborhoods. These institutions will receive the condoms from the district councils, and they will avail these condoms on their institutions and infrastructure so that their staff and client may have access to them. We also have another route is through the civil society organizations such as NGOs and CBOs that receive the condoms through the district councils, but also the CBOs and NGOs at the district level may receive the condoms as sub-recipients from the provincial headquarters. For instance, if we have a mother organization, that organization will distribute the condom to the sub-recipients at the district level. And These CBOs and NGOs, after receiving the condom, will avail the condom to activists and the peer educators. And in turn, these activists and peer educators will make the daily distribution of the condoms at the community level until the last mile. And it is important uh, to highlight that through the activist actions and the peer educator actions and other champions that exist, we have the possibility to reach some places that without these actors, it would be very difficult to reach or even impossible because they're the ones who understand and know their communities and the people at the district level, at the administrative post level, at the community level, and also at the last mile level. So they have a very important role in the distribution, granular distribution of the condoms to the last mile and the last beneficiary of this condom. Next slide, please. We have here some images where we can see in the first image on the left, on the top left, we have a brigade composed by different organizations that are about to act as a commission. So they united their efforts to distribute the condoms to the people that participated in this commission. Below we have a vehicle with the condoms, and it's from FDC, and they're sharing from the province level to the subrecipients, to the administrative posts, to the district, and so on. And we also have on the top right two activists that are doing a night distribution of the condoms in hotspots, and below we have an activist distributing the condoms at the community level. Next slide, please. Now I will speak about the district container for condoms. Dr. Ivandra has also shared a bit about them and the main idea behind them. I'll also talk about some aspects that Dr. Ivandra, through their presentation, has also demonstrated that the availability of the condoms in our country has been improving through time. We saw the graphs since 2016 until 2022, that the graphs demonstrate that this availability has been bettering at the national level. But despite this improvement, we still have great gaps in the distribution process, especially in remote areas. In some areas, we have limitations because there is no vehicle accessibility for the distribution of condoms. We also have other gaps, even through the storage capacity at the district level. And in this context, in partnership with the Global Fund and in coordination with central organs of the government through such as the Ministry of Health, that is a great partner. We wish to allocate 40 containers to 40 districts that have been selected. And these containers have as the main objective storing the condoms, be it male or female condoms, and the storage of the lubricants so that there is a sustainable coverage of this deficit and strengthen the distribution chain for the condom and strengthen the distribution system at the national level, that because it is composed by CMAM and the private sector and also the National Council and their subordinate councils. These containers have the main prerogative to increase the storage and availability capacity for condoms and lubricants at the community level, be from the district to the neighborhood and or even blocks. Can we go to the next slide? In short, these containers that are in this process of acquisition will receive the condoms through the DPMs, and they will avail this be at the institutional level, at the NGO and CBO level. And as I said before, they're supposed to increase the capacity and availability for distribution of condoms at the district level. So this initiative will allow better availability and accessibility at the community level. And these condoms should be available at the right time, in the right amounts, and above all, in the right quality. Also having the consideration of the segregation of condoms through flavors, so that the lower level has this option, these choices. So, for instance, they can choose between strawberry and banana or other flavors. And it is also important that there is a quality maintained. There are some stereotypes that public distributed condoms have a lower quality than privately bought. Next slide. In this slide, we have a short overview, and the arrows showcase the distribution routes. And as I said, the condoms go from the DPMs and then go to the provincial councils, but also the district deposits, and also where the containers are available, they will go there, and in turn, there will be a distribution to the district council, to the public and private institutions, to the CBOs and NGOs, and finally, the priority populations at the district, neighborhood, ward level are reached, and these condoms will be reaching the last mile wherever the beneficiary is, be it at a community level, at a block level, at a neighborhood level. These beneficiaries should have access to the condom, and this is what we are doing. So I'll finish my presentation here. Thank you, Maria, for this presentation. We'll go now to the question and answers. Are there any questions? I saw a few on the chat, but I'd like to see whether the participants have anything to say, and then we can go to the chat question. Any question? You can feel free. I can't see any hand raised. In the meantime, I noted a few questions for the Dr. Ivandra. We don't have her here, but Dr. Teixeira can respond in her place. Rosemary asks whether there is an inclusion of the condom from the government. Apparently, it wasn't noticed or noted this aspect. We also have Arminda that wants to see the challenges of the distribution from national to provincial level, especially for female condoms, because at the district level, there's some stockouts for the female condoms. She also asks in which way does CMAM have to ensure that there is no challenges. Dr. Teixeira, you have the word. Thank you very much. I'll try to respond and give some support to Dr. Ivandra because she's in another meeting. With regards to the government condoms, the condom governments are a large shipment of condoms that are included in the essential medicine kits, and so they're part of a kit that will be directed to the communities. We use these, and we don't have the quantities that arrive from the government, but we need to do the accounting for the kits and then convert. And each kit has 200 condoms in 2 cases of 100. and then we need to include them in the plan. They are unfortunately exclusively masculine condoms, and they just arrived. We just need to do the accounting and include the shipment in the national plan. The second question is a bit more complicated, and I would like Julia to support me because she had the opportunity to visit the provinces in these last weeks as part of this reproductive health program. We need to analyze this aspect, but the female condom doesn't have as much consumption or quantities as the male condom. And what we saw is that CMAM has the distribution capacity, but it's a planned distribution and it's made the quarterly basis. We need to keep in mind that the condoms have a high volume for the national chain. It has to be a well-planned distribution and it's done quarterly. Sometimes we do a emergency actions, but usually condoms are not included, are just medicine and other consumables. And many times what happens is at the provincial level, the female condoms get accumulated and or they get pushed to the health institutions. These organizations have a level of autonomy and they can push to the health institutions and other organizations. But what happens is that we usually have a surplus of these condoms and they get accumulated, and sometimes the DPM gets overloaded, and or we have a stock out for the provincial level institutions. Many times this kind of availability is very important for key populations. What we noticed is that we have the surplus in these health institutions for the female condoms. I'm not sure if Julia wants to add. Thank you, Jean. But you basically covered it all. Many times the condom is there, but we need to create demand and acceptance in the community for these condoms, but also at the staff level. Sometimes the condom exists, but there's no demand and there's no knowledge of the importance of the female condom. I wanted to add that we really need to create demand for the use of the female condom. The other part that I wanted to mention is about the storage capacity that affects the condoms in general, but the masculine is specific because we have great levels and there's some limitation on the central zone. There was a great damage during the Idai hurricane. There was great pressure in regard to that. The Global Fund availed funding for the betterment of the storage in the central zone. And right now, they in their storage facilities are in the process of renovation, building, and expansion. It's really good because in the future we'll also have better capacity and for availability of condoms or in the central zone that includes Zambezia also, but right now we have this limitation. This store warehouse should have been ready in September or October, but I think they will only be ready by the first half of next year. So now we have the situation in which the storage in the north and the south being overloaded. When we have this overload, we end up losing quality management, including the correct loading, the correct flavors, the correct also expiry dates. We also have a few challenges in this chain, but we also have some aspects of management, and I think Aminda asked this about better coordination at the provincial level in which we need to analyze the available stock, which should be for the consumption for 3 to 5 months. And if there's a push and distribution on the health institution, what will happen is that we'll have an overload of stock in the health institution, but there is a stock out at the provincial level. So this equilibrium bit is very important. And we also want to talk about the competition with COVID products that had a high demand that competed with the transport facilities and even the storage facilities. There's another point that I want to raise is that we don't have an infinite financing. So even for 2023, we had here a process that we have been working to have the financing for the condom for 2023. And usually we had already gotten like the financing for the next 12 a month. So if we don't have the financing, all the acquisition process and procurement process gets really complicated. And this year, even Arthur from the Global Fund noticed that the needs that we thought that there would be financing from UNFPA uh, ended up being covered by the Global Fund. So due to the savings on IR3, we were able to finance the condoms for 2023, but we don't have an infinite financing for the coverage of all the needs that we might have, especially with regards to the female condom, which is a bit more expensive than the male condom. So we have uh, work to do. We need to go to the health institutions to see what are the needs in this institution so that there's no push made uh, uh, that is made in a blind way or not based in data, so that we also don't have these imbalances at the province level in which there are critical activities that don't have condoms, but we also have like a surplus of condoms in some institutions. I think there's another question from Arminda, or I'm trying to look for the question. Oh, for the flavored female condom, I think that we've already talked about this. We need to finalize this conversation and see the impact that it has at the price level. And then we can see the purchase plan and see whether it's possible to exchange it with these flavored female condoms. It's an open discussion that hasn't been closed in the technical group. I finish here. Thank you, João. I think you still have a few additions to make because I can see the Rosemary asking whether Mozambique does a quality control to the condoms received at the national level, and whether there's a, a surveillance post-market. Hand you the word again, Joe. Thank you for the question.
Thank you very much for your question. I think this question is related to the how the condoms are how the condoms are kept in the containers. Well, I don't have a precise answer for this question. I don't know if Artur and the colleague can assist me on this question, but I think we only have quality control, which is done or in a pre-indicated situation whereby it's done before the condoms arrive the country. So I think we are collecting them in a systematic manner. This is the samples in the communities, which is also sent to the quality mechanisms. And this it's what assures that that the condoms have the right quantity and quality as it was before it was sent to us. Thank you very much. I'll pass the word to my colleagues. Julia or Artur, I don't know if you have any contributions relating to this question. Well, sorry, the mic is off. Artur, please, you can proceed. Well, thank you, Izidio. Well, regarding to Global Fund, we have a certain procedure that we follow regarding its manufacturing and the quality. But regarding the marketing, I think my colleague can be able to respond to this question. But I think after we actually get to meet and talk about it, we'll be able to have a precise answer to share with you. Thank you very much, Artur. Julia, you wanted to share? Well, I wanted to say exactly what Artur said. Well, in terms of analysis, we do some samples according to the provinces, and on the lowest level, I don't know if they do this quality control. What I know is that this control is done up to the provincial level, not on the community level. I can't answer much regarding the community level. Thank you very much. Any other question? Well, Izidio, on the proposal, there is a fund that is given for the ANAM to do. This is on the fund for Global Fund for ANAM to be able to do this quality guarantee post-market. This, yes, is related to the chair, but it's the regulatory board that does this quality guarantee and control of the quality to the market. This is for the private and the public sector. Well, João, I think you can say, what does ANAM mean? Well, ANAM is the regulator authority. Well, the name is mostly for the medication, but also covers all the other products that are related to medicine. Let me go back to the chart and see if there is any other question. Well, some that I think the questions which can be answered by the technical group was posted by Arminda. I think this is for the technical group to be able to share and be able to answer these questions. Here, I also see a question by Seru, which is asking the following: how does Mozambique deal with the effects from condoms to end users? Or how do they get feedback of such reports, and do the victims get any compensations, monetary or any type of support? I don't know if the colleagues can be able to respond to this question. Kavitu, are you available? Say, I think the question needs to be well presented. So with what are you referring to when you say the adverse effects? Or I don't know if you can give any example. Thank you. I was saying if I can try to answer. Yes, you can, Julia. Well, if I understood the question very well, I think he wants to know how do we do regarding the adverse effects regarding the results. So we have the notification files in our health centers, which help us to be able to analyze the results. So when any type, when the health center receives of effects that this patient had because of using the condom, maybe an allergy reaction like that, we'll be able to know what types of treatment this patient will need to be able to heal from this reaction or effect from the condoms. So we try to, what we same kind of situation, that's when now we are able to do a deeper follow-up of this situation regarding the quality of the condoms and effects that patients are having. Thank you. Well, I'm not seeing any other question, but I think on the first trimester we must have a meeting and to be able to look into these points. Next slide, please. Next slide. Well, here we are going to give the floor to the countries which are here present. We'll start with Nigeria, then Tanzania, then Uganda. So what are the key takeaways that you managed to get from this meeting? Jerry, please. Nigeria, please take the floor.
Good day, everybody. I'm Kingsley Simon, working for National Agency for Control of AIDS, Nigeria. Though I joined the meeting very late and battled with the translations, I only can appreciate Mozambique. But maybe when I now go through the slides, I'll be able to bring what my key takeaways are. Internet connections and others. Thank you.
Thank you very much, Nigeria. Tanzania, please take the floor.
Hello, everyone. I'm a representative from Tanzania, and thank you so much for a very detailed presentation. So from our side, what we have taken note is how you handle or you manage condom to reach to the grassroots levels. And also from the presentation, we were able to pick up some of the common challenges that we also face here, making sure that condoms are available to the very remote or hard to reach areas, which is a thing I think is open for further discussion as the SSLN together, all the countries, to see how best we can manage or make sure that these condoms reach the very hard areas to reach. Otherwise, thank you for a very good presentation. And I can see quite a number of similarities on our distribution chain or line. So this is impressive, and we are grateful to be here. Thank you.
Thank you. Thank you, Tanzania. Last, Uganda, please take the floor. Uganda, please take the floor. It looks like we don't have anyone from Uganda, but well, we took note of what Nigeria and Tanzania have shared with us. Next slide, please. Well, we are going to have a pop-up on our screen, and we request that each of us fills in regarding our meeting. And after this, we can all log out. And I would also like to thank everyone's participation in this meeting, whereby this time it was Mozambique who chaired the meeting. So I would like to ask you to, when you have time, please come and visit us in Mozambique. Come enjoy our beautiful beaches and see what we offer. Thank you very much.
Sorry, I missed most part of the presentation. I think I'll just take advantage of the presentation when you share to really go through this. Sorry about that. Thank you.
Well, thank you. The presentations will be shared, and any feedback is welcomed. So with this, we can end the meeting, and I would like to thank everyone's presence here and for sharing what you had to share with us. Thank you very much. See you next time. Thank you, Izidio. This was a very, very nice meeting. And I would also like to thank you for creating this meeting and be able to share with all of us. Thank you. Thank you, João. Let's continue like that.